Role of doxycycline, statins, and steroids in dengue. So current role, many of times we see in many of the prescriptions that patients or clinicians are prescribing doxycycline, but the national guidelines of dengue suggest that there is no role of doxycycline, and this is no established role, and it is not recommended for routine use in dengue by WHO or Indian guidelines. So however, why it was thought to be used was basically because of its anti-inflammatory action. So because dengue is an inflammatory state, anti-inflammatory action could be useful. That's what it was thought. So it inhibits dengue virus replication by interfering with NS2B, NS3 protease and matrix metalloproteinase inhibition. Conclusion, it is not routinely recommended for dengue unless there is co-infection with other diseases. Statins is also having anti-inflammatory action, and often it was thought that it could be useful. Basically, mechanisms is it is immunomodulatory and endothelial protective effects, reduces cytokine production, and improves the endothelial function. So guidelines currently recommended this have not included in 2023 Indian or WHO dengue management guidelines. It has promising but experimental, not standard therapy yet. Corticosteroids, it may suppress the cytokine storm, could benefit patients with severe capillary leakage. Suppose there is usually too much of leakage, basically is because capillary leakage basically occurs because of the inflammation. So this was thought that suppose patient has severe capillary leakage or shock, sometimes the steroids can be useful, but routinely it should not be given to all patients, used only for specific complications, not in general dengue shock or plasma leakage. So current recommendation, doxycycline not recommended, statins is investigation only, steroids not recommended routinely, only for selective indications like severe dengue capillary leak, which is not responding to the IV fluids therapy or to the blood transfusions as well. If it is not responding to that, then it is the treatment of choice. Now, important thing